Welcome and good afternoon, everyone. Thank you for being here. My name is Kristen Kong, and I'm the HEAL Project Coordinator, and I will be chairing this session and giving you a brief tour of our new digital platform. I would like to begin with our land acknowledgement. So, Access Alliance acknowledges that we operate on the traditional lands of the Huron-Wendat, the Anishinaabe, the Haudenosaunee, and the Mississaugas of the Credit. We recognize the deep and ongoing impacts of colonialism that includes genocide, forced displacement, and residential schools on Indigenous peoples. As settlers, immigrants, and descendants of those brought here through the transatlantic slave trade, we are committed to learning from Indigenous communities, honoring their resilience, and taking action against colonial violence through solidarity, accountability, and shared stewardship of this land. Indigenous communities across Canada have long honored the passing down of knowledge through stories, practice, and relationships that connect generations. This living wisdom strengthens community health and artistic expression over time. So, really, our new platform is truly inspired by these traditions, celebrating the sharing of knowledge in arts and health so that continues to support and uplift future generations. So I would like to now invite Cliff Ledworth, the Acting Executive Director in Primary Healthcare, to share opening remarks. Cliff.
Great. Thank you, Kristen. So welcome everybody to today's webinar and to this exciting moment for Access Alliance. And it is exciting for us in a number of different ways. I think first of all, it is another way that Access Alliance is able to provide care and support to our clients, our patients, our communities that we interact with at Access Alliance, and it brings in another method, another modality of being able to do that. My background is as an art historian, so anytime that we are involved with something that has an arts focused, I'm particularly excited about that work. Art in all of its different forms can bring us such joy. It can bring us contemplation. It can bring us opportunities to be able to reflect on where we are in our lives, what types of things are unfolding in our lives. It can also help us to better deal and manage some of the impacts that we experience as individuals and as communities. Art and health are intricately connected in my mind. And it's wonderful that in this agency and through much of the hard work of Kristen and Lana and our partners in this work, that we're able to take on this area and be able to further develop it and be able to present it, be able to offer those services, and be able to take all of that knowledge and all of that learning that we have experienced and be able to make it available on a website for our partners and for other people to be able to access and be able to share in. Kristen, I think it's also really important that the project has also generated some thinking in terms of where we go in the future. And at the recent gala celebration that we had about this work, there was some discussion there about how do we move forward. And one of the things that was said that evening was, wouldn't it be wonderful if there was an artist on every team? And so we want to pick up on that, and we want to look at ways that Access Alliance with its partners can bring artists into the interdisciplinary team in community health centers, in partnership partner agencies, and really bring that power that art has to be able to influence us, shape us all in positive ways. So lots to celebrate today in terms of the website, and lots also to look forward to in terms of the future and how we can better position the arts and artists in the interdisciplinary teams that we have, so that everybody in our communities can benefit from tapping into the arts in a very positive way. Enough said. Kristen, back over to you. And thank you very much for all of the work that you have done in making this project move forward, and to all of the people that have supported you in terms of your team in making this work become a reality.
Thank you. Thank you, Cliff. And thank you for touching on that really important component of sustainability. And I think, as we go through this platform, we'll realize that, it's not just an archive, but really a starting platform for so many of the things that have happened in the last 2 decades of Access Alliance and beyond. So I would like to now invite AKM Alamgir, who is the Director of Organizational Knowledge and Learning, as well as our HEAL Project Research Lead. So AKM.
Thank you, Christine. Thank you, the team. So I'm very happy to see Axel here. So what I'll do, I have a big plan to say so many things, but I'll dedicate most of my time to Axel, to kind words before I say the rest. Axel, can I request you, please? And if I can say before Axel start, Axel actually is the owner of the project who brought the project in and took Christine in, took me in, and Cliff nurtured it so that we could come to a completion. Thank you, Axel. Axel, please.
Expressive arts and art therapy is something that Access Alliance, all of our health promoters, all of our managers have been so supportive of for so many years. And we've always thought it was an amazing strategy to do amazing work addressing determinants of health with folks really facing so many barriers. As this research will show, and we've done many initiatives. And so this project, which, AKM and Kristen led so amazingly, is just, our ongoing development and evolution. So I've always been a champion, as ED, that's part of our job, is you champion stuff, but, you support other people to do their best amazing stuff, which is what's happened here. So I'm so proud of all of this work, and I am a super advocate of expressive arts. Just a personal story. My mother has dementia and lives far away from me, and so I'm on the phone with her and on FaceTime every day. And I encourage her to do art every day, and it is incredible for her, who's socially isolated and alone and struggling with mental health. She's doing art every day, and it is such a beautiful thing. So that's just one little example, and that's a kind of low-level, benign example. But for, as Cliff was saying, some of the work that we do with the different client groups, it's truly transformational. And so I'm thrilled that we're creating this platform to share tools that we've either created or we've just been able to access and then share with everybody who's doing this work. So it's because that's, again, all of us work in this space, and we all have to share resources and collaborate and partner. So I'm just thrilled to see this. So back to you, AKM.
Thank you very much. So I'll start borrowing one statement from Cliff. Art and health are integrally integrated. Thank you, Cliff. This is a great statement that needs interpretation. Couple of pages. I'll not going for that. So welcome everyone, the partner organizations, funders, members of the advisory team, members of the board of directors of Access Alliance, members of the partner organizations, members of Knowledge Hub, with who we are going to we are going to host a webinar tomorrow, members of my research team, and our HEAL project team. So today is a gala moment, and also everyone who I missed, is a milestone that we started a complex project, and Christian was new, so we started with multiple challenges. But I am happy that with continuous work ethics, and dedication and passion of Christine, we could complete it. Now, if you see the success, it's all the success goes to the team and Access Alliance senior leadership, who allowed us to do according to our research design. And we are grateful to Research Ethics Board. They actually approved all those pieces that we mentioned, and we are stick to the Research Ethics Board recommendation that I must tell loudly and clearly that we abode by all the recommendations and approval of Research Ethics Board. And our advisory team and partners, without you, we could not make it happen. With challenges, you helped us. With limitations, you helped us. And you helped us with all your resources, efforts, and your infrastructure. Thank you very much. And lastly, this is an accomplishment that showcases our tools that we developed, the techniques that we developed, the challenges that we faced, intellectual properties that we achieved and accomplished so far. To who? To everyone who visits the website. At individual level, the members, respected members who experience in their own life or in their neighbor's life or someone's life they know near and dear ones who have experience of gender-based domestic violence. The supporters, they may be service providers, maybe community supporters, they can use with the tools. Clinical service providers, they will use some of the tools. Policy planners, they will use the findings, next step, next generation policy finders that will actually support our survivors, support our members, newcomer women, and create good set of law and orders, acts, legislation for supporting. And it will use the academics, because a program and research always does not go together. And particularly if it is an implementation research. So we try to utilize all the principles of implementation science. So this is a unique example for the academic researcher. So with these things, and all the credits goes to Christine and the team and the senior leadership of Access Alliance. And if there is anything wrong, if there is anything that is missing, lacking, excuse, I apologize for that. That is my fault. So that is my limitation. Please, thank you very much. Let's congratulate the big moment of hosting the website. Christine, now to you to host the website. Thank you very much.
Thank you, AKM, for that introduction of the website as well as the HEAL project. So now I will begin the exciting part. So really at the heart of this work is our belief that Access Alliance Arts for Family Health is one of our strongest tools. It honors many lived experiences of those who are helped shape this digital platform to really advance the role of arts within healthcare and settlement for newcomer communities. This platform has grown out of many, many years of practice within Access Alliance, as well as our partner agencies and community members, and of course, through the recent implementation of the HEAL project, running from April 2022 all the way to March 2026. So the emergence also is informed by many conversations over the last 2 decades and also the past 4 years. From the very beginning, working with service providers, participants, conference communities, and our own team, we saw the need and heard the need for a shared meeting ground, one that brings together different disciplines, interprofessional teams, as well as wisdom passed down across time. So, this idea of co creation really was essential in creating something like this. It ensured that the tools on this platform are not only practical and usable, but also reflective of the cultures, the languages, the stories, and strengths of the lived realities of the people that we serve and work with. So, once this vision was clear, we partnered with Ilana Wilner and her team at Launchbox to bring it all to life. They were our website developers. And after many months of dreaming and drafting, content creation, and testing, we are thrilled to be launching today and show you this platform that we have created. Throughout this process, we were also guided by a very simple but important value, which is learning should be shared. Knowledge, stories, and insights should not sit, in silos or remain hard to access, but really by sharing these lessons learned, best practices, we can continue to advance what it means art as an effective and very meaningful approach for newcomer mental health. So ultimately, when we share what we have learned openly and very thoughtfully, we can strengthen not only our work, but also the communities and cities we care for. So I'm going to share my screen now, and we're going to look at the site. I'm going to give you a short tour, and we're going to get going on exploring. Okay, here we go. Okay, are you able to see my screen? Yes, okay, I see some nods. Wonderful. So please put any questions that you might have in the chat, and we'll try to answer that during the Q&A portion of this call. So Access Alliance Arts for Family Health is a living resource, meaning that the site is more than an archive of information, but it's very dynamic. A lot of the content on the site is curated by our team in real time. And so what you see now is going to be looking very different in terms of all the content created in the coming months. So always you can check back onto the site. So here you are seeing the landing page of the site. The main purpose is to offer practical, easy to use resources for arts integration. When you scroll down, you will see a list format of easy to click resources you can begin with. Each resource has its designated icon, color, a title, and a brief description to spark your curiosity or need. I want to draw your attention as well to the right-hand column. What you see there is a section called What's Happening. It will showcase things like upcoming webinars, workshops, training sessions, and the one that's happening tomorrow. And just below it are featured resources we want to highlight. And these are really thrilling, newly published articles or tools that we want to draw your attention to, with clickable links here at the bottom. So let's return back to the main navigation and click on the About section. The About page is a long history of art-based work at Access Alliance. It gives you a little bit of a blurb of our past 2 decades of using arts within the health promotion model and to really improve newcomer well-being. You can also learn more about the HEAL project by clicking on these really easy links to the HEAL project as well as the resources. And we also, with the work of Lana and implementing many expressive arts programs, we have come up with the Arts for Mental Health model of care that you can learn more about. And as you scroll down, you will see this beautifully woven expressive arts trailer produced alongside Alejandra, who is on this call today. So thank you for your work in capturing the beauty and experience of a lot of our participants at both our Jane and Danforth site. At the very bottom, we also feature our funders who have believed in the work of the arts within the health sector and settlement, as well as our growing list of partners. Okay, I'm going to scroll upwards, and I tried to practice scrolling slowly so that no one would get nauseous. Okay. So the HEAL project, you can also see there's clickable links that will bring you to our milestone reports, giving a summary of each of the years of this project, as well as our team, our approach that really instills community-based participatory research, and of course, importantly, our project impact at a micro, meso, and macro level. And we also speak about sustainability, what happens after a large project like this. Okay, so I'm going to jump back all the way up to the top. And of course, you'll have time after this webinar to read more thoroughly into the details of that project. Okay. So this is one of the robust sections of the platform and is truly the hub of a lot of knowledge mobilization products that you can freely use. And it is called the Resource Hub. It has a search engine that you can see here with two different types of searches. The first is audience. You can search by research and academic, manager, leader, or practitioner. Then on the second search bar, we have content types. We have 7 different content types that you are able to search through, and in the bracket is the amount of content within that category. I will go into detail in one moment. On the right-hand column, if you're needing support finding a resource, you can book a 15-minute consultation meeting with us. And so we can discuss what are your needs and maybe if we can find something that supports the work that you do. And then down here, we have new releases. So new publications of tools or resources will pop up in this section. And then on the bottom here, we have a very cute word cloud with keywords that you can search very easily for another way of filtering. So now I'm going to bring you through some of our content types. So going back up here to the content type drop-down menu, I'm going to click Activity Guides. Activity guides are similar to quick user guides. They are very much for implementation staff who implement programs or want to implement expressive arts programs. Once you click on one, it will bring you to a resource landing page. This provides a summary of what that session plan is about, a little bit about the audience profile to get you acquainted, participant benefits, recommended art materials, and the best section is the downloadable materials. It provides a full session guide as well as handouts and printable materials. So again, activity guides are really quick, ready-to-use sessions, focusing on newcomer mental health using the arts as a tool. You can adapt it to your population of focus and your practice. The second one is facilitated trainings. So facilitated trainings is distinct with its dark blue icon. Facilitated trainings is really a continuation of capacity building for folks like peer ambassadors or peer leaders in your community. So I'll just click on one right here. Again, it will come to a resource landing page with a summary of what that training is all about. It will also have training objectives so that you can quickly scan through, is this what your organization is looking for? And then at the very bottom, it will provide you all the training manuals, the handouts, activities, as well as a training impact report of the pilots that we have done at the agency. So those are facilitated trainings. These ones you can book us to facilitate at your agency, or we can show you how to use the different manuals. Okay. The next resource or content type is HEAL resources. This is one of our biggest content types of the website. You can see here it is distinguished by its purple icon, and these are all the tools, evaluation, planning documents that we have produced to implement the HEAL project. So there are things like milestone reports, all the way to planning documents like logic models or theory of change. We also have provided in-person, and post-program data collection tools. So if this is something interesting to you when you're implementing expressive arts programs, you're able to click on these to see what tools we have used in this project. We also have post-program resources such as healing arts for newcomer well-being event, gallery painting booklets, and co-design reports. So again, this is truly all drawn from the HEAL project and all the things that we have used during the past 4 years. The next content type is how-to guides. How-to guides is distinguished by the red icon. These are also ready-to-use guides on how to use, for example, a button maker or integrate an artful check-in or checkout. mindful art implementation, as well as those managers out there and leaders, how to hire art-based facilitators as a part of your agency. So this is truly at a, system agency level. And again, when you click on one, it will go to a resource landing page with a summary and all of the clickable links that you are needing. All right, so I'm going to go back here. The next content type is program and research reports. Program research reports are really important because it brings together feedback that we have gathered from participants across a whole year. So we have annual reports of all our expressive arts programs, as well as specific reports like our Nesting Ground program, which we use community arts practice for as part of our referral process. So if you're wanting to learn more about how we model our expressive arts programs, you are welcome to click on these again, and it will show up with the annual arts reports. We have two more sections left. So the research papers. This next section is characterized by the gray star icon, and it will come up in just a moment. This section is really for a growing database of research that we have found very useful in developing the HEAL project as well as the Expressive Arts programs. This section is very, can be interested for academics out there who are wanting to learn more about also community-based research. And so you can click on some of these and it will give you a link and summary to some of this research. So it is also quick gaining of knowledge. And then lastly is toolkits and handbooks. This section is very useful for managers and leaders wanting to know kind of more a broad framework of the things that we have done. And it is distinguished by the blue icon. So you have things like the Stepping Up Toolkit, which is an implementation also of expressive arts programs. We have an arts material toolkit. So if your organization is new to building an arts inventory, this one is very useful. And then we also have things like peer researcher handbook, as well as everyone can do research. So this is also very useful for agencies that want to equip themselves with more research practices. So that section is our resource hub. Our team will be publishing more resources in the coming months, so do check back and also pace yourself through this content. I'm going to then now jump to, on the main navigation menu, stories and articles. So stories and articles is one of the most dynamic areas of the site. It features 4 different types of text-based posts. The first one is articles around art and health. So I'll just click on this one. This one was about our Healing Arts event. It showcases, things that we have done, as well as really interesting topics like trauma-informed expressive arts or artists as part of the interprofessional team. So these articles are a really great way to see what type of references that we have been using, but also to advocate within your agencies what evidence is out there. The second type of article are things called social media campaigns. So social media campaigns, we know that it reaches a wide variety of audiences. This features past social media campaigns focusing on the 16 days of activism against gender-based violence, as well as May Mental Health Month. What's really great about these articles is that it talks about the campaign focus, but you can also download a sample of our campaign. So if you don't know where to start, you can gain inspiration and language from things that we have already published. The next article I would like to show you is webinar features. Webinar features are things like something like today. We did a webinar with the Learning Network and Knowledge Hub a couple months back, and so we're featuring something like this so that you can watch on your own time. You can also see the full webinar on their website, as well as our presentation slides as well. And then the last article that you can click on is one of my favorites, which is participant stories. Over the course of the whole summer, we recorded 11 participant story testimonies of participants that have been coming to our expressive arts programs. And so this one is featuring Vishal, who comes to our Tuesday Tune programs on the rooftop of the Danforth Garden. And so you can watch a 2-minute video of his experience coming to our programs. Okay. So last but very not least on our main navigation, we have a section called Connect with Us. This platform, as you can see, is a result of many dedicated contributors that we have met along the way. And so there are a couple ways of connecting with us. One of them is booking us for trainings or learning about what trainings that we do at the agency to build capacity. We also have a section for art assistant volunteers. This is also open to community members that want to lead within the arts programming and also sustain their mental health along the way. We also have a section, and we have actually a growing list of community artists and art-based facilitators part of our roster, those who have expertise in arts as well as experience with newcomer populations. And then, of course, our student placements. We have a variety of placements open to public health, social work, expressive arts students as well. And then again, on the right-hand side, if you need help finding a resource or want to see a resource on a platform like this, connect with us. We would love to hear the things that you're thinking about and also percolating. And I'm just going to scroll to the very bottom here. If you do want to send us feedback on the footer at the bottom, website feedback, you can click on there and it will direct you to our email. And you can share with us kind of some comments or feedback as you have gone through the website. Okay. So I'm just going to go back all the way to our main menu. So after this webinar, of course, we invite you to take a moment, put on some music, take a break, and explore the many artful offerings on this website. We're excited to see how you will use it and also expand this space together. So I'll just end off by sharing, under the Article 27 of the Universal Declaration of Human Rights, it actually affirms that everyone has the right to freely participate in cultural life, enjoy the arts, and share in all of its benefits. So when we begin from this place, arts access is not a luxury. It's actually essential and foundational to well-being, dignity, and belonging. So I just want to extend our sincere gratitude to the Public Health Agency of Canada for funding this creative platform. Gratitude to Ilana Wilner and the Launchbox team for developing this website with us. Victor Cito for graphic design, Marco Campana, who's on this call, our Knowledge Mobilization Action Coordinator, AKM and all of our research fellows, and the many placement students and volunteers who have supported every single part of this phase. So thank you. And with that, I'm going to stop sharing my screen and open it up to questions and comments.
Thank you, Christine. Now the floor is open for question and answer. We'll be happy to take your questions. And if we cannot answer right way, we'll record it, note it, and we'll return you back as soon as possible. So we have about 20 minutes for question and answer, please. And it was not an easy task to create this web design. It was a difficult task that where Heather, where Marco, Christine, and other people, they worked very intricately, they very diligently for months together, honestly, with the firm that actually who created it. Thank you very much for everyone. Please. Axel, do you want to start? And Cliff, you have.
Well, I did put my hand up. I was just wondering, um, so as anybody who works in not-for-profits know, every year is a adventure in terms of piecing together support and resources. That's why the funding we got for the HEAL project was so amazing, because it was a big chunk of money, as well as the support from the Peterson Foundation, which was also no strings attached, which anyone who works in the nonprofit knows that is the most beautiful type of money, because we really then can allocate it where it's most needed. In the website, you do reference, or you do suggest, that there's going to be an ongoing presence in terms of programming, aside from what you're putting out on the website as supports and activities. Is there what's the ongoing plan post March for the programming at the organization? Because I'm sure partners are interested too, right?
About the sustainability, we are trying to explore opportunities. For one example, such as we applied for more sustainability funding for to PHAC,
Mm-hmm.
and they actually reviewed our proposal and told us to do it in different way, in a little bit different technical way, so that they can read it easy for their own structure. And that is, it is a positive
Mm-hmm.
notion that they are going to fund. We asked for 46,000 around, right, Christine? $46,000, and if we get it, we can continue the knowledge mobilization part. What did we learn, and how we can uh, impact the communities? Like first thing that I and thanking to Cliff, and because Access Alliance already for everyone, Access Alliance already decided to create post positions for art-based therapists or facilitators for every program. So that is a big in-house jump excel for sustainability. And then also at individual level and system level, we are trying through this website to include more people. This is a beginning. Actually, the way that you showed us to start and now is another milestone. This is a beginning of new set of partnership, collaboration for impacting and sustaining it. Cliff, you want to
Yeah, I think one of the things, and again, I referenced this when I was putting out the welcome to people at the top of the webinar. I think one of the things that we want to commit to is, what's the framework that we want? What is that goal that we're looking for? And that artist on every team, I think, is our sort of rallying cry in terms of how we would want to proceed forward. I think part of the answer Excel in looking forward is, taking advantage of some of the funding that is now coming into primary care through the IPCT funding, and IHPs or allied team is a part of that structure. So working with our partners in the different OHTs to say we would like one of those positions to be an art therapist or to be somebody who can advance this work. And because that funding is permanent, then that person would be or that role would be an embedded permanent role in the work that we're doing. So I think that gives it the piece of permanence that is important if you want to continue to advance this. And then I think another piece is project funding. So what's project funding that we can identify that can start to enhance and continue the various pieces of work that we see here. Part of the advocacy piece, I think, at the OHT level is to demonstrate how important it is to have an artist or an art presence part of interdisciplinary teams. If people don't see the importance of art or art therapy or an artist being part of the work that we do, then we can't change that. We can't change that structure. And then I think from a partnership perspective, we've got partners that we've already been working with. And I think we have to expand that structure, that partnership, even more into the arts community because they need to be advocating for their place in health and on interdisciplinary teams and the kind of work that they can do that's always beneficial to the clients and the patients that we see. It's another lens. It's another way of looking at the work that we do. It's another way of supporting people. It's another way of bringing change to people by having art and health be very intricate. Oh my God, I can't say the word. Very tied together as we move forward.
Yeah, I mean, I think like that's such an exciting piece of this. And it's not like it's a new like I'm just reflecting, in hospitals they would have, music therapy, art therapy, clown therapy for kids, for example. And so
Yeah.
this is just, the way that Access Alliance and other organizations, to our partners, can do it, focusing on, again, specific determinants of health, specific populations, specific, in our case, for example, one of the things we did was at Access Alliance look at pre-migration experiences and how that affects the settlement. But then,
Mhm.
looking at our existing structures and positions and everything, and then changing them as everything changes over time as we learn. So that's definitely a takeaway for, I guess, even all of our partner agencies. Go back to your organization and see how can you integrate some of this work, these resources, into what is your ongoing work. How can positions be, tweaked and adjusted over time. I mean, just like we've done it, integrating, the work that Lana does into our settlement programming. So I just think, and what you were saying, AKM, you talked about this, and Cliff also, like, how do we look at, expansion opportunities or new funding, but core pieces to integrate this. I just, that's again an example of like systemic change that, so much that's what we are about. We know that the current system within which so much of our work is taking place has to evolve, has to change, has to be more responsive to the changes in the communities that we work with. So I just think that's really interesting, and a takeaway, for everybody sitting around the table today, and other partners, and the resources will be such well, just great to support that. So again,
Yeah.
this is such exciting stuff.
Yeah. Can Kristen, if it's okay if I add another minute to this, I
Yes,
think,
please.
at Access Alliance, one of the things that we do really well is when we see that opportunity, we're very diligent about following through on it. And I think an example that we have in the agency is the health coach position, which, Excel, you'll remember when we first took on that project, like over a decade ago, like health coaches were not something that were very well known. We made a commitment, and 10 years later, we've now had 3 health coaches on staff, and health coaching is a much bigger part of the discussion in the system. And so it's a model for us when we think about having an artist or an art therapist present on an interdisciplinary team. We have to identify it. We have to continue to do research about it. We have to continue to gather information. We've got to constantly point out the benefits that having that role brings to the team, and in particular to the clients, the patients, the communities that we work with. And, if we stay the course, I think that, we will see that artists or art therapists, people who can advance the arts for health purposes, will become a standard part of the work that we do in primary care or in the primary care sector.
And the last comment that on this topic, Axel, this is about structural continuity, structural sustainability, and about intellectual sustainability. If folks, if you have seen that during our research, we found that gender-based domestic violence is a stigmatized word. So all through in this website, we mention family health. Family health. That means it is so that everybody can participate, and domestic violence is a part of family health, integrity of the family. So we translated that language into more generic and well accepted language. So linguistically, we want to make it sustainable as well. So thank you. Any other questions from partners or participants? I see Shankari, I see Serena, I see Nasima, and Giselle from PHEC. So Giselle, do you want to make any comment about?
Sure, yeah, I'll happily jump in. Thank you so much for having me, and it's a pleasure to be part of this process with you. I know you guys have been working diligently on having this project be a success and really working at seeing the results and seeing the data from this. So I'm happy to be able to help you guys. Just from our end, from the point of view of Public Health Agency of Canada. We are looking into the possibility of that amendment. However, nothing has been approved yet. So I just want to give you the caveat that we're still waiting on a decision, despite how much I want to champion it. But yeah, everything's going well. So I'm really happy to see the launch and I wish you the best of luck.
Thank you very much. Tomorrow will be the webinar with Knowledge Hub. So Kristen will send you the link and Annalie is here. So please, I'll request you to present there as well.
Kristen, as I was scrolling through some of the comments, I mean, there was a lot of people here who are students, are art therapy students, and so there is this group of people who are training, they're educating, they're waiting to be able to apply all of that knowledge and skills that they're developing in their school setting. So it's not like we're without a resource to be able to tap into, and it would be great to be able to get to a place where the young people who are in that education moment in terms of becoming art therapists are going to be able to practice as part of a team. And then I just saw another comment by Mafalda about the embroidery work. And the other thing that I'm struck by in this work is that people come together, and they're doing work with their hands, or they're creating with their hands, or they're creating on a wall or something like that. And that also sets a tone for people to be able to very easily share feelings and emotions and stories. And so it's such a natural setting too, when I think about the group work that happens in an art and art therapy based setting. It's a really wonderful opportunity that makes it easy for people to come together, and to share their stories, and then demonstrate those stories in the artwork that they're producing. Like, so many opportunities.
Yeah, for sure. I'll just say we've been working with a lot of Create Expressive Arts students, supporting with, newcomer well-being programs as well as our nesting ground programs. And what we're seeing is exactly that. When people come to group programming, they actually receive the, psychoeducation that they need to understand their mental health, and they actually don't need to necessarily see a one-on-one social worker or counselor. And those group programs happen every single week. So sustainability for that is really amazing. And then two, our agency gets to learn more about expressive arts programs, right there and then real time with expressive arts students. And some of them are on this chat. So thank you for being part of so many really, creative, beautiful programs that we've kind of put together in the past couple of years. So, and also to note that many of them have shared that they never saw themselves at a community health center. Many of them go to hospices or work with children. But actually, what we're saying is that you have a place as an expressive arts student in a community health center, especially working with newcomers. So I think, the art sector is also seeing what their role is within sectors like ours. Mm-hmm.
And I want to hear one or two sentences from our partners and members of the advisory team and facilitators, please. Because you are very much part of it. We started with you. You encouraged us to do this. You guided us to do that way. And we are here today. Thank you, Serena.
I know for me, this is just so incredible, having been, involved in art therapy for close to 20 years now, and keeping my eye on it. I haven't seen such an exciting and comprehensive resource that's been developed, and the research to back it is amazing. And I think, it's so innovative to hear that you're actually going to incorporate it into health teams. And I've it's something that I could have only dreamed of 20 years ago. And I think it's absolutely incredible to see that you were able to have the Canadian government fund it, and then to be able to do such a tremendous job demonstrating the impact, and then making it something sustainable like the website, to be able to carry it forward and really be a stake in the ground for so many other art therapists that are interested in continuing to do this work. So I think it's amazing.
Thank you. Mafalda, you want to say something from Barbara? Yes.
Oh, I was not expecting that. Thank you for inviting me. So I have been an art therapist now for almost 5 years. I met Kristen in a hub when this project was actually starting. So I was part of the initial brainstorm meeting about how to plan the group settings, the 10 sessions. So thank you, Christine, for giving me that opportunity. And yes, I did the research through my practicum. This was a while ago now. So if you're interested, I put the link in the chat. I did publish the article, which actually got a grant from the Canadian Art Therapy Association. And yeah, I'm very open to collaborate with you guys. If you ever need a group facilitator, I would love to join the team. Thank you.
Thank you very much. We got you. Shankari?
Hello, hello everyone. So nice to be here. As always, Access Alliance has done this great job. The website looks amazing. I will take some time to read more, explore through this, and interesting part is about the tools available there, like manuals or guides for anyone who want to do the art therapy. And working in the frontline sector, I know how group sessions makes our clients happy, and they come there, meet new friends, learn something. And I was lucky to be part of one of the few group sessions to do presentation. So happy for this. Good luck to Access Alliance. And as always, I wish good luck to this great organization. Thank you.
We have 2 minutes. Georgia?
Hello, thank you. Hello, everyone. This is big news. Sorry I jumped on very late, but it's nice to see Kristen in person. I've been in communication, well, sort of in person. I've been in communication with you over the years, and it's just amazing to see the growth that's happening with the programming, in particular the HEAL project. That's really exciting to me. And I'm here, just I make a habit of, if I'm sitting on one of these webinars, just to state who I am. I'm a visual artist. I'm an expressive arts therapist, and just recently been appointed, and I think there's a couple students on here, been appointed to create the Create Institute as the associate program director. And so this is quite exciting to see all the hard work, all the backstory stuff that's happening, and now you get to launch this. So I just wanted to just formally say congratulations, and I hope to be involved in some way, shape, or form. Thank you.
Thank you. And actually, we wanted to hear from everyone, but we have only 1 minute. We respect your time. So as the last person, I want to ask Nasima to say, because she was from the beginning a part of our advisory team, and she hosted one program for us. Nasima, can you for the last minute?
Yeah, thank you, Alamgir. Sorry, I cannot show my face because I'm in the doctor's office. Yeah, I'm very happy to see the result of this project, and it's really nice. And thank you, and I'm happy to be part of this from the beginning. Thank you.
Now, Kristen, to you.
All right, wonderful. That brings us exactly to 1 o'clock. Thank you, everyone, for taking time. And of course, after this, I hope that you spend time gallivanting through the website, clicking on the many buttons and tools. And I really hope that when you do use something or are inspired, please reach out to us. I mean, I would love to hear how it is adapted and inspires the work that you do. So thank you again. And